Hello, I'm your nurse today, Megan, and I'm going to talk to you about osteoporosis. Osteoporosis is a medical condition in which there is bone loss due to hormonal changes, a deficiency in vitamin D or calcium. Basically, your bones become brittle and porous. Some of the signs and side effects that you may see with this condition include back pain, a loss of height, a stooping or a shortening of the spine, kind of like a stooped posture, not quite hunchback, just a little bit more stooped. Weak and or brittle bones, or excuse me, nails. I got bones on the brain. And also a recent fracture from a fall. Some risk factors that may put you at a higher inclination to get osteoporosis include a previous family history of it, menopause before the age of 45, chronic, chronic steroid use such as corticosteroids longer than 3 months, and also to be of an Asian or Caucasian descent, or even having a sedentary lifestyle. In other words, you're not getting the physical activity that you should be getting on a daily basis. Some things that you can do in order to prevent this disease is to engage in such exercises such as going walking, jogging, even dancing or playing tennis would help. You could also increase calcium or vitamin D intake with certain foods such as there's broccoli, milk, dairy products, even beans and legumes have calcium in them. You can also avoid excessive alcohol and even tobacco use because that can lead to brittle bones and even other complications. A few other things that you could also do to help prevent this would be to prevent falls in your home with safety measures such as non-slip socks and or shoes, making sure that your rugs are attached to the floor appropriately, and even having a flashlight beside your bed at night to make sure you have adequate lighting to get to and from, say, the bedroom to the bathroom. And also be sure that you're seeing your healthcare provider on a regular basis in order to, if you do get diagnosed with this condition, to manage it and also to implement other things to help improve your daily life. Excuse me. A few ways that this is diagnosed is mainly through what's called a DEXA scan or a dual intensity energy X-ray. This particular scan estimates the amount of bone mass that is in your body, especially in like your hips and your spine, because those are two of the bigger bones that are found in your body. And if you are diagnosed with a score or DEXA score of negative 2.5 or less, such as negative 2.6, 2.7, and so on, that confirms the diagnosis for osteoporosis. If you have a score of like negative 1.5, I believe, or higher, so like negative 1, negative 2, that kind of thing, it's just considered to be normal bone mass levels. Excuse me. A few things that you can see nurses do in the hospital or even on your in your nursing homes to help implement this is to be sure that they are promoting an understanding of the disease, such as explain to them what this condition is and how it's brought on, how they can prevent it, much like I'm doing today. But also be sure that that patient is asking questions and that be sure that they just understand. Try not to use too much medical jargon. Again, judge your patient. How much do they understand? Be sure that you are also discussing the treatment regimen, such as medications, exercise, procedures, things of that nature. A few things that you can do if you're an inpatient setting is the nurse can help relieve pain by either administering a pain medication like an NSAID or an analgesic of that sort, but also using things like a hip wedge to help relieve the pressure off the hip when the patient is laying down. Also, be sure that your patient is not constipated, because constipation leads to a number of concerns and issues. Again, prevent injury for your patient. Make sure oxygen tubing is not laying on the floor, that they have their call light beside them, the things that they need within reach. Basic things that we all learn in nursing school. With patients that may have osteoporosis, be sure that you're encouraging a diet that includes calcium and vitamin D rich foods to help supplement what they may not be getting on another regular basis. And be sure that you're encouraging these patients to keep their regular appointments with their doctors and other healthcare staff, again, to manage and treat and prevent. Excuse me. Some of the medications that are used to treat and manage osteoporosis includes a classification of meds called bisphosphonates. These medications inhibit osteoclasts from causing bone loss, but also increasing the bone mass. Some people may ask you, well, what medications do this include? These include Actonel, Fosamax, and even Boniva. With Actonel and Fosamax, these are typically taken once a week, and you want to be sure to tell your patient to remain upright after they take this, and be sure that they take it with at least 240 mLs of water, or 8 ounces. There's also another medication out there called Boniva, which is only taken once a month. Now, if your patient has trouble remembering the once weekly deal, then maybe recommending the once a month to the doctor could be an option. Just kind of weigh your benefits with your provider and your patients. Some other things that are available are just vitamin D and calcium supplements. Calcium and vitamin D are both needed for bone formation, and to be sure that they're both being absorbed by the body. So calcium is more responsible for the actual formation of the bone, while vitamin D is responsible for the absorption of calcium within the body. Excuse me. According to the National Osteoporosis Foundation, it is recommended that those with osteoporosis or have a potential for osteoporosis take at least 1,000 to 1,200 milligrams daily of calcium, whether, again, through foods or supplements. And vitamin D kind of depends on what age range you are. If you are under the age of 50, it is just recommended for 400 to 800 units of vitamin D. However, if you're one of the lucky ones that are 50 and over, then it's recommended that you take 800 to 1,000, more so on the 1,000 side of it. Typically, that's what I see from the nursing homes and the few floors that I've been on is 1,000 units. Excuse me. There's also a few procedures, if you will, that are available to help treat and manage osteoporosis, and these are more so an injection or an infusion that you could get in your doctor's office. So the medication Prolia is an intramuscular, or IM, injection that is given once every 6 months, while Reclast is an infusion that's given through an IV every year, once a year. That's so easy. And it's usually about 15 to 20 minutes long, again, but it takes place in your doctor's office. You may be wondering what are some of the complications that one could see with such a condition, and mainly it's you're at more of an increased risk of fractures. Fractures being anywhere between your spine, the hip, and even the wrist. They say the wrist because if, say, you go to fall, most people try to catch themselves before they hit the floor, and it's your wrist that is being broke. It's your wrist that's being cracked and taking all the impact. So that's why they say that those with osteoporosis are at an increased risk of wrist fractures. However, some of these fractures can also lead, unfortunately, to disability or even death. I hate to say it, but it could happen. Mainly because if you are in a nursing home or in a extended care facility and you're not getting the activity that you need, you're not being mobile and this and that, and you can't move because of your fracture, you're at a higher risk of said disability or even death. Um, with a fracture, this can also inhibit certain daily activities. So, say you fall and you crack your hip because you have osteoporosis, it's more brittle and it's not gonna, it's healing, but it's not taken as quickly. You may see that you're gonna have a harder time getting around your apartment or your house. Even simple things like taking a shower, you may need assistance with. So don't feel bad if this happens to you. It's nothing to be ashamed about. Just be sure that you're asking for help. I hope that this video gave you a little bit of insight into osteoporosis, what it is, how you can manage it, and even how you can prevent it. If you need any more information, please feel free to send me a message in the comments and I'll get back to you. Thank you.